My name is Heidi Childs, and this is my informative speech. My topic is how to start an IV. This is my lovely patient Anna today, who's volunteering for us. IV therapy is used to treat patients for dehydration, anesthesia, and to provide life-saving medications. Chances are that you or someone close to you will need IV therapy at some point. So I wanted to go through the process with you step by step so that you can feel confident whether you're a healthcare provider or just a patient that needs an IV. A successful IV start includes good preparation, confidence, and a specific process to ensure success. I'm currently a nursing student and recently became certified to start IVs, so I feel confident to explain the process to you. I want to teach you the steps to successfully start the IV. So the first thing you will need to do is to gather your supplies. Things you will need include an IV start kit, which includes a catheter and needle. You will need a tourniquet to find a good vein. You will need gloves so you can maintain a sterile field. A ChloraPrep or an alcohol wipe to cleanse the skin and prevent infection. And a saline flush so you can test your IV and make sure the placement is correct and that it flushes well and that everything that needs to get into the vein will get in there. So first thing you're going to do is assess your patient. I'm going to look at Anna's arms. I usually look and feel. I found it's best to go by feel rather than look. Sometimes you can find a good vein where you can feel the vein even if you're not able to see it really well. With an older patient, you might want to use a warm compress or a warm blanket and wrap their arm in it. This will help the veins stand out and just come to the surface of the skin, and you can save yourself a lot of trouble if you can find a good vein that way. So once we wrap the arm with the warm compress, we're going to apply the tourniquet. Where you're going to apply the tourniquet depends on where you've decided the best IV site is. This is a visual that shows the vein anatomy of the arm. Some common sites are the antecubital vein, the median cubital vein, the ulnar vein, and the radial vein. For surgery or trauma, they like to go to the elbow veins, which is the antecubital or median cubital. For less invasive things, less caustic meds, they'll like to use more of the forearm so they can save those bigger veins for other meds if they need them. So, but on Anna today, we'll probably just go with the AC, which is right here on the pinky side of the arm. So I'm going to place the tourniquet on her. You want the tourniquet to be tight enough to constrict the blood flow, but not too tight where it's hurting your patient. So you pull the bottom part over and then tuck it in. And we'll just ask the patient to squeeze their hand a couple times, kind of pumps the blood, or another trick is to ask them to pretend like they're lifting weights. And that works well too, to get the vein to pop up. So as you can see, Anna has two good ones right here and here. I would just feel, and I think I would probably use the antecubital for Anna. So I'm going to take the tourniquet off just for this demonstration, but normally you would leave that on. Thank you, Anna. Next, you're going to get your IV start, and I like to wiggle this part a little bit, just make sure it doesn't stick, otherwise you can have a hard time advancing your catheter. So I'll put that back on. If you can see, there's a bevel. You want it to always be bevel up when you're inserting it into the skin. So we're going to first cleanse the area with the ChloraPrep that I mentioned. This is one that you crack and shake it. And you're going to start from the center of your site and do an outward circular motion. So you want to, I always try to go bigger than smaller so that if you need another site, it's already clean for you. So once you've cleaned your site, you don't want to touch it again. You want to maintain that sterile field. I'll put on my gloves here. And I'm not really going to stick Anna for this demonstration, but I will still show you the steps. So So here we have our needle. I'm making sure it's bevel up. I'm going to apply traction to the vein. That's just some pressure distal to your insertion site, and that will prevent your vein from rolling. You're going to start at a 30 to 45 degree angle. You're going to go in quick. You got to get through the skin and the vein. And as soon as you see a flash of blood in the chamber, that means you are in the vein. You want to advance it just a couple millimeters more, and then start advancing the catheter. So the way to advance the catheter is with these butterfly ones. You're going to hold it on the sides and then push it forward with this finger. So you're going to push it off so the needle comes all the way out, and then just this plastic catheter is left in the patient's skin. I always like to reassure patients that there's no needle left in them. It's just the plastic catheter, and they usually feel a lot better about that. So once you have it placed in the skin, you're going to use an IV flush, a saline flush. You want to get all the air out of it. Make sure you don't have any air in there, so just a little bit can bubble up. You're going to attach that, aspirate a little bit of blood, so it'll turn pink right in here. And then you will just slowly flush that. I usually do about 5 mils, and that will tell you that you're in the vein and that your medication will flow smoothly. So after you've got your site all prepped, your IV in, you've flushed it, you're going to apply a Tegaderm. This is just a dressing that has a window in the middle that you can always visualize the IV site through, and that will just hold everything in place and make it so it doesn't come out when the patient moves and whatnot. So assuming that you're all done with your IV therapy, the patient no longer needs vascular access, you can remove it using remove the Tegaderm using an alcohol wipe. The alcohol just helps dissolve the glue around the site, so they don't have so much pain from the tape. And then you're going to get a piece of tape and gauze and just place that over the site, remove it in one swift motion, and make sure the catheter tip is intact. That's important so that there's no pieces left behind, and doesn't result in an infection. So that is the process to insert an IV and gain vascular access. Whether you're a healthcare worker or a patient, understanding the process makes the whole thing less stressful. You want to include good preparation, confidence, and this specific process. And by following these steps and using every opportunity to practice, you can become confident in your ability to start an IV in any situation. So that's starting an IV. Thank you, Anna.